Hello, I'm Hannah Donnett with the Collaborative on Health and the Environment. Che enjoys bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to today's webinar titled Environmental Health Impacts of Synthetic Turf and Safer Alternatives. Our moderator today is Sarah Howard, founder and manager of diabetesenvironment.org. We will leave time following the presentations for a brief Q&A session. You may type in questions to the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentation, our moderator will read out questions for our speakers to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone in the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 75 minutes and is being recorded for our call and webinar archive. So with that, I'll turn things over to you, Sarah.
Thank you, Hannah. So today we're going to have actually 4 speakers. The first 2 are from the Toxics Use Reduction Institute, TURI, at the University of Massachusetts Lowell. First will be Dr. Rachel Massey, who is Senior Associate Director and Senior Policy Analyst there. And she works on a variety of projects, including figuring out how businesses and communities can reduce toxic chemical use. Lindsey Pollard is a special projects research associate and works on projects like identifying chemical hazards in consumer materials and finding safer alternatives. They'll both discuss their project assessing the hazards of materials used in artificial turf and then present safer alternatives. Next, we will hear from Dr. Zhenyu Tian, who's an assistant professor at Northeastern University in Boston. He was recently a postdoc at the University of Washington, where he worked to identify the chemicals in stormwater that were killing coho salmon. He's going to discuss the toxicity of these chemicals, which are found in tires, and the toxicity of the crumb rubber used in artificial turf. And finally, we're going to hear from Dr. Sarah Evans, who's an assistant professor of environmental medicine and public health at the Icahn School of Medicine at Mount Sinai in New York City. She provides guidance to communities and decision makers on the potential health impacts of exposures from playing on artificial turf. She will discuss concerns specific to children's exposure and how people can minimize risk. So I also want to note that there are links to all the studies and all the many resources that our speakers are going to mention on the slides and resources tab on the web page for this webinar. And if you have questions during the talk, you can type them into the Q&A button and I'll read out the questions at the end after all the speakers are finished. So with that, Dr. Massey, would you like to begin?
Great, thank you very much, Sarah. So Lindsey Pollard and I are going to present some of the work that we've done at the Toxics Use Reduction Institute related to artificial turf and safer alternatives. I'll just start with a very brief introduction to our work. The Massachusetts Toxics Use Reduction Institute is one of the implementing entities for the Toxics Use Reduction Act. We have a mandate to work with businesses and communities to reduce their use of toxic chemicals, and we see this as a form of primary prevention of disease. We have a focus on inherent hazard of chemicals, and in a lot of work, we do assessment of alternatives, and the goal of that is to avoid regrettable substitutions in which a chemical or material of concern could be replaced with another chemical of equal or greater concern. We also look in all of our projects at opportunities to identify efficiencies and cost-saving opportunities, and this is true for our work with large and small businesses as well as communities. So I'm going to briefly share with you some of the topics that we have looked into related to artificial turf. And all of these topics have grown out of queries that we have received from communities and institutions as they're working to make decisions about these materials. So we'll talk briefly about the use of waste tire materials in infill. Then we'll touch on the use of alternative materials as infill. and we'll speak briefly about PFAS in artificial turf carpet. We will then just say a little bit about some of the other concerns related to artificial turf. And finally, we will talk about organically or sustainably managed natural grass fields as a safer alternative. And while I'm on this slide, I just want to point out that, as you can see in this image, artificial turf is a multi-layer product. So there's a layer of artificial turf grass blades, there is a layer of infill that provides resiliency to the surface, and other layers. And all of those are worthy of taking a close look at as you're making decisions. First of all, just a little bit about tire crumb. There is a large quantity of waste tire material that enters the economy every year, about 4.5 million tons in 2019 and similar amounts in other years. And for a variety of both technical and policy reasons, most waste tire material doesn't get recycled to create additional tires. So there is quite an active amount of work by both governments and industry to find other ways to use tire materials. In the slide in the middle here, you see a tire processing facility that would be creating either tire shreds or tire crumb. And then on the right-hand side of the slide, you can see some of the uses of that waste material, a landscaping use or a use of tire crumb in artificial turf. Tires contain a variety of ingredients. There are natural and synthetic rubber polymers, there are fillers, there are vulcanization compounds, and other chemicals. And so there are quite a large number of toxic chemicals in tire crumb. Some of the categories include metals such as lead and zinc, polyaromatic hydrocarbons or PAHs, phthalate esters, phenols, volatile organic compounds. There was an EPA literature review that was done a few years ago that identified over 350 chemicals that at that point had been identified in existing literature on tire crumb, and other chemicals have been identified in subsequent studies. One of the projects that we have done at TURI is that we've taken a close look at a comparison among a number of infill materials, and this work came out of queries that we were receiving from communities that were interested in finding out if they didn't want to use tire crumb, whether there was something else that they should choose instead as an infill. And we did this within the broader context of an alternatives assessment methodology. What we did was a hazard-based comparison, and a couple of factors in setting up this kind of examination is we had to deal with the fact that these are complex materials containing many chemicals, and in general there's not a lot of disclosure about the exact formulations of these materials. On this slide you can see some of the alternative infills that have been on the market that we took a look at. There are alternative rubber materials such as EPDM rubber, ethylene propylene diene terpolymer, or waste athletic shoe material. There is thermoplastic elastomer, or TPE, which is a plastic product. That's kind of a broad term. There can be a variety of material formulations within that. There is infill made from acrylic coated sand. And then there are mineral and plant-based options. So the mineral-based options can include sand or zeolite, which is a particular concern due to respiratory hazards. And then the plant-based options include coconut fiber, cork, walnut, shells, wood chips. There's a variety of materials that are used. So we did a comparison based on information that we were able to obtain about chemicals present in these materials. We looked at the limited amount of published literature on the materials, and then we requested laboratory test results from vendors, and also to a limited extent we were able to have some additional lab testing done on samples that we had available to us. And so the summary outcome of this examination was we weren't able to identify any infill material that was clearly free of any concerns. So some of the alternative materials contain some of the same chemicals of concern as those found in tire crumb. However, we did generally see that they can contain either a smaller number of those chemicals or lower quantities of those chemicals. So, there is a continuum, and it is likely that some of those materials are safer than tire crumb, but not completely, but there's still some concerns. And we also just note that the infills are just one component of the artificial turf system, and other components also require careful examination. I'll just say about the mineral-based options, as I already mentioned, zeolite is a particular concern as a respiratory hazard. And for sand, industrial sand, if it's freshly fractured or has been processed to create very small particles, then that could be a respiratory hazard as well. And for the plant-based materials, they each need to be examined individually, but there can be some concerns related to respirable dusts. And it's also important always to check whether a plant-based material has been treated with any of the industrial chemicals that could be of concern. I'll just note that there's a new study just came out very recently that also looked at infills. They looked at infill samples taken from many countries around the world and found evidence of a variety of toxic chemicals, including some samples that exceeded a newly adopted European regulation on levels of PAHs that are permitted in infills. And they did include some examination of alternative infills. So for example, for TPE, they found that PAH levels were lower, although phthalate levels were higher. And they found that the cork options were generally didn't have the chemicals that they were focusing on in this particular study. Although again, there are other questions that need to be examined for those plant-based materials. And they flagged concerns for microplastic pollution from any of the rubber or plastic materials. Another topic that we have been getting quite a few questions about in the past couple of years is the issue of per and polyfluoroalkyl substances in artificial turf, grass blades, and other components. For those of you, I assume most of you on this call are already familiar with PFAS, but for any who are not, this is a broad class of chemicals that pose serious concerns because they are highly persistent in the environment and have a variety of adverse health effects. And increasingly, PFAS are being found as contaminants in public water supplies. So we've created a fact sheet on some of these PFAS topics, and I found that one of the issues that is useful for people to have some information about is what is involved in testing a material for PFAS. So again, as I've mentioned, there are thousands of individual PFAS chemicals, and many of them break down into a common set of degradation products. There are EPA lab testing methods for just a small fraction of that universe of chemicals. So there are methods for 29 PFAS in drinking water, and recently EPA put out a draft test method for 40 PFAS in additional media. But so for communities that are trying to investigate the presence or absence of PFAS in a product that they're considering purchasing and installing, it's also useful to look at other test methods. In particular, a total organic fluorine analysis can give you information on the presence or absence of any of those compounds that have a carbon-fluorine bond. Also, in some cases, a total oxidizable precursor assay or TOP assay is useful. That's a test that subjects the materials to the conditions that would lead to breakdown into degradation products, and then tests for the presence or absence of those degradation products. So it doesn't give you information on which specific PFAS are present, but it can give you a yes or no answer on the presence of certain PFAS. So in general, more information can be obtained by using more than one test method. Moving on to some of the other concerns with artificial turf, there are a variety of environmental impacts, microplastic pollution, both from the infill particles and from the other components of the turf that break down over time, including the artificial grass blades, water and soil contamination, chemical runoff, habitat loss, and use of antimicrobials to clean and disinfect the artificial turf surface. Also, disposal is a concern. Based on current evidence, most artificial turf is not recycled. And, so in many cases, a field may, when it's installed, it may be an opportunity to reuse some waste materials, but then at the end of the useful life of that product, those are waste materials again. And these products generally need to be replaced after 8 to 10 years. Heat and injuries are also concerns, but you'll hear about those later in the webinar. And then just another topic that I want to touch on very briefly, because this also comes up in some of the queries that we receive from communities, is people have questions about what research has been conducted on the question of human health effects of playing on artificial turf fields. And I think it's just useful to understand what research has and hasn't been done. So there's been a lot of work, and this primarily relates to exposure to tire crumb as opposed to other infills. There's been a lot of work on materials characterization, on environmental monitoring, testing of releases to air or water in a laboratory setting, some very limited exposure biomonitoring and toxicity studies. And then there have been numerous risk assessment studies. And as many or all of you may already know, these generally build in a set of assumptions related to which chemicals are most worthy of consideration and what sorts of exposures may occur. So there's a large number of assumptions that are built into those risk assessments, and those assumptions then have an effect on the outcomes of those studies. And what's really one of the things that's lacking is there haven't been any well-designed epidemiological studies to really investigate the question of whether young people playing on artificial turf fields have an increased risk of cancer or other adverse health effects. So with that, I will turn it over to Lindsey.
Thanks, Rachel. We included natural grass athletic fields in our assessment, and specifically looking at organically or sustainably managed grass. And we found that this was the safer alternative to artificial turf fields, and it also a cost-effective and very practical alternative for artificial turf. And these organic and sustainably managed grass techniques really focus on building a healthy soil and grass ecosystem, which therefore provides a resilient play surface. Also, it can reduce or eliminate the need for pesticides, and in many cases can help reduce the demands of water on those fields. So these maintenance practices can include aeration, soil testing to make sure that there's a nice balance of nutrients in the soil, which can then be corrected with the proper amount of fertilizers, frequent mowing, and using the appropriate type of grass for the environment. Those are all some examples of maintenance involved with organic and sustainable grass management. And I'll also just point out that artificial turf also requires maintenance. And sometimes, well, usually with specialized equipment. This is not just a set it and forget it system. And we've received a large number of questions from decision makers about organic management of grass, and specifically about costs associated with this type of management, how many playable hours you can actually get on these grass fields, and also how to get started on switching over to organic maintenance. So we've put together 5 case studies that document communities that are using organic or sustainable grass management for their athletic fields. And I've pulled out 2 examples here, Springfield, Massachusetts, and Martha's Vineyard. So starting with Springfield, Massachusetts, their organic program started back in 2014, and it focuses on really just using those core maintenance practices such as aerating, frequent mowing, and soil testing. And since then, they were able to eliminate pesticide use on their city athletic fields. We estimated that the annual cost of maintenance, including labor, was around $1,500 per acre. And I'll also note that these fields do not need to be shut down for maintenance or for resting, and game cancellations are rare. moving, I'll point out an example field just to take a look at the use hours. This is Treetop Park. It's a regulation size soccer field, primarily used for soccer practice and games, and also some other recreation like pickup games. And we found that in 2018, this field was used for around 1,050 hours. Moving to Martha's Vineyard, they also use core organic practices and are also focused on maximizing playtime and eliminating field closures. And they do this by adding on some additional techniques and technologies to help them identify problem areas on field. So they use drone photography and soil moisture mapping, for example, to help pinpoint those bare spots that might be popping up, or the compacted areas that can be targeted and alleviated quickly. And this is a visual of the wide spectrum of different maintenance methods and costs associated with those methods. So starting with just very basic methods focused on revitalizing an existing grass field, all the way over to building a brand new sporting complex with all the bells and whistles. And to wrap up, I'll introduce a few additional resources that can give a little bit more information about artificial turf and grass management. So Healthy Building Network has put together this really great hazard spectrum that has these drop-down menus that can give you more information on the athletic field options, ranging from organic grass down to crumb rubber on synthetic turf. And I'll also point you to our webpage, which is turi.org/artificial turf. And this is where you can find all of our information, much more information on artificial turf in the form of documents such as reports and flyers and fact sheets and videos as well, and also more guidance on switching to organic grass, which we did again find as the safer alternative to artificial turf. And with that, thanks so much. And please feel free to reach out to us if you're part of a community that's trying to make these decisions about your athletic field.
Great, thank you so much, both Rachel and Lindsey. While we're waiting for our next speaker to pull up his slides, I would like to remind you to start submitting your questions. We already have quite a few coming in through the Q&A feature available on the menu bar at the top of your window. We'll begin the Q&A session after the final speaker's presentation. And I'll pass it off to you, Dr. Tian.
Hello, everyone. Okay, so I guess you are seeing my screen. My name is Zhenyu Tian, and I am an assistant professor working at Northeastern University. It's my pleasure to introduce some of our work on organic contaminants in tire rubber and crumb rubber. These are mostly the work that I've done at University of Washington. So yeah, I need to clarify a little bit. I'm mostly a chemist, not a toxicologist, but I work with toxicologists. Okay, so let's go. Here's the outline of my presentation. First, we will have the acknowledgement, and then I'll introduce some of the work on coho salmon mortality and the tire chemicals. If you are familiar with this part of work, bear with me in that. And after that, we will go to the ongoing research about crumb rubber chemicals. Okay, so for the coho salmon work, most of these projects are done in University of Washington Center for Urban Waters. And another key team to this project is Washington State University PELUP, Jim McIntyre's group. And we also have collaborators from other institutions. So this is really a highly collaborative interdisciplinary work. So I appreciate everyone for their support and help. Okay, so what led our research to tire rubber is a phenomenon called urban runoff mortality syndrome, URMS. So probably you know, salmon is a big deal in Pacific Northwest, and in every fall, salmon is swimming up the creeks to lay their eggs. And a specific species, coho salmon, their time is late October to November. And people have noticed that, especially in the urban creeks, when coho salmon are swimming up the creeks to lay their eggs, they are showing weird symptoms like losing equilibrium, gaping for air, and if they can swim, they cannot swim in like a straight line. It's almost like drunk, they're swimming in circles, just like this video shows. So yeah, so this is kind of like a weird thing, and once they show this symptom, the coho salmon are killed just in a few hours. And the issue is many of the coho, they died before they can lay their eggs. So this is actually impacting their population. And according to the projection, if this trend continues, coho salmon in this area could die out just in a few decades. And this is also weird because, you know, for some other species like chum salmon, they are fine with the urban creeks. They did not show the same symptoms. So this is quite like specific to coho salmon. And our collaborator has been tracking this phenomenon for more than a decade. And our collaborator from NOAA and WSU, they have found there's a correlation between the mortality risk of coho and the urbanization gradient, especially the traffic intensity. And here's the model map on the left, right? So generally these different colors of area are generated according to this urbanization gradient, and it actually predicts the mortality risk very well. So you can see in the areas, these are the traffic heavy like places, and the coho mortality risk are usually about 40%. So because of this correlation, they began to think this is probably something related to the road runoff, the traffic, right? They collected samples from busy highways like this bridge, and the runoff, they exposed the coho salmon to this runoff, and they found coho showed same symptoms as in the urban creeks. They are like pretty fast. So from there, our collaborators know this phenomenon is probably related to the roads or the cars, but the toxicant at that moment was still unknown. And when our team at the University of Washington came into this project, the first thing we do is to develop a series of chemical signatures for coho mortality. We are using a special method called high resolution mass spectrometry. So it allows us to see many chemicals in a complex sample, not even without standard, without like established method, we can see those. And with this method and the samples collected by citizen scientists, we have the samples from mortality events in 2016 and 17. We also have the road runoff that we know kills coho salmon. So when we have all these samples on our instrument, we can see the chemical features in there, and overlapping these different waters. All those waters are lethal to coho salmon, right? We can see what are the chemicals present in water wherever coho are killed. So this is our coho mortality signature. And we have this 57 chemical features. And using this group of features, we can track the performance of specific treatment system. And also we can use these signatures to track the source of contamination. And because we know this is something related to roads or cars, we tried to see if we can track anything related to this vehicle-related sources. Generally, we have different vehicle fluids and oils, like all this listed here. So in this figure, we can see each of the line is a sample. And the ones highlighted in red are the samples that we know related to the mortality, right? The lethal water samples. And each of the column here is a chemical feature in the mortality signature. And we use a statistical analysis to see the similarity of different sources versus the lethal water samples. And turn out that while all the other fluids and oils are not quite related to the mortality related water, the tire wear particle leachate cluster together with this lethal like water collected on site. So from there, we know there's a closer relation or like a similarity between tire particle leachate and the real stormwater on site that kills coho. And our collaborator also confirmed this from the biological side. Using tire rubber leachate, they exposed both adult coho salmon and chum salmon. We know in the field, coho are killed by stormwater, but chum are not affected, right? So after a whole day of exposure to tire leachate, all coho are killed while chum survived. So this is exactly the same phenomenon we saw in the fall creeks. And this is a clear evidence that the tire rubber leachate are toxic to coho. So our question is, what are the chemical, the lethal toxicant in the tire rubber? And because we know that's a set of mortality signature, right? So we are able to buy some chemical standard, although not all of them, but a part of that signature compound. We make this home run mixture, hoping that if this mixture into a fish tank can kill fish, then the toxicant is probably in there, right? We made the same concentration as in the road runoff, as well as like a 10 times higher, concentration mixture to, and we dosed both to the coho salmon, but they were not affected. They don't even show any symptom, so that we know the toxicant causing this mortality is not in the signature, or at least not in the standard that we are able to purchase. So it's probably a more difficult mystery compound that we need to dig out. So we have to do it the harder way. That is to do the tire leachate fractionation. So we can see the photos here are how we make the tire leachate. We first cut the tire particles from a whole tire thread, and then we put them into stainless steel column and use a pump and water to leach them for a whole day. And then we collect the tire leachate. The reason we need to do the fractionation is the tire leachate itself is chemically complex. Usually we are able to see more than 2,000 chemical features in tire leachate. So we are not able to pinpoint what is doing the, having the toxicity. So the logic of fractionation is based on different properties of these chemicals. We separate them into different parts and expose these specific parts to coho and see which part is toxic. Then from that toxic fraction, we are able to identify smaller amount of samples so that we narrow down the scope from the 2,000 to smaller numbers. And here's a figure that we have in our final paper. And you can see this is just one figure, but it takes us almost like 2 years to go down from, like more than 2,000 features to only about 4. And we go through a series of different chromatography column separation. You can see, in the beginning, we have like 1 out of 3 fraction that's toxic. And in later stage, we have like 1 out of 10 fraction that's toxic. And through this number reduction process, we have like a relatively simple chemical, like a fraction that still kills coho salmon. And in this final one, we only have 4 features, and it actually dominated by 1 feature that has this chemical formula of C18H22N2O2. And look, if you dry down this fraction, it show up this like pink-red solid here. And when we dissolve this solid to fish tank, it can kill coho just in a few hours, like we see in the creeks. So we know this is our toxic chemical. However, when we are searching for what this chemical is, there's another challenge because we don't see any information about this formula in literature or database about tire rubber chemical. What we have is a true unknown that probably no one have seen it before. So my assumption on this is, say, this is probably not something people directly put into tire, but something transformed into this chemical, right? With this assumption, we are searching for chemicals with the same carbon and nitrogen atom, but may have different oxygen and hydrogen, right? And with this, we found a chemical called 6-PPD, which is a tire antioxidant that's really used in almost all the tire that we are, running on the road today. And you can see 6-PPD is a very common chemical. You can buy it in large quantity, like kilos and tons. And under $3,000, you can buy it a ton. And yeah, it's supplied everywhere. And more interestingly, we see that in a old literature from the 1980s, ozonation product from 6-PPD called dinitron has exact the same formula as our unknown. So that's another important evidence showing that probably what we have come from 6-PPD. So with this knowledge, we bought 6-PPD like industrial standard. We did a ozonation and we see the color change like this, from a lighter color to a darker color. Apparently something formed. And then we compared our ozonated mixture with the tire leachate, and we can see the same chemical with the C18 formula showed up is basically the same thing, because we see the chromatography retention time. You can see the black and the red, that's the same peak. And also from our mass spectrometry, we see the spectrum are the same. So we know it's the same thing from the tire leachate and the ozonation of 6-PPD. And when we are doing our collaborator was using NMR to tell us the exact structure of that compound. Surprisingly, we know this is not dinitron from the 80s paper. Instead, the structure is like this, right? The oxygen is on the aromatic ring. So this chemical is called 6-PPD quinone. And we have this semi-synthetic quinone. We actually dose that to coho salmon. And we can see that the symptom of the lab exposure versus the field are very similar. So they are swimming generally like on their side. And this is qualitatively telling us we got the smoke reduction at 60. And after this work has been published, we have seen following work from all over the world, from the Canadian snowmelt to air particulates in China. People have seen 6-PPD quinone, because whenever you have a car, you have this traffic, have the tire dust, you will see 6-PPD quinone in there. And their concentrations are sometimes not very low. We also have a following work on 6-PPD quinone, because there is commercial standard of this chemical. Well, when we are doing that, we don't have that, so we are using the in-house standard. And by comparing with the commercial standard, we realized our in-house standard was not very pure. So our LC50 and the environmental concentration were higher than the real value with the commercial standard. So we have an update with the commercial standard, and now we see the LC50 of 6-PPD quinone to coho salmon is around 95 nanogram per liter. So this is really low, and environmental concentrations are also low. But this very low LC50 make 6-PPD quinone a very toxic chemical to aquatic organism like coho. And also there's a following study on other species. This one from Japan, scientists found that the 6-PPD quinone, although it is very toxic to coho, is not toxic to some freshwater organisms such as zebrafish or Daphnia. So again, this is showing this species-specific sensitivity. But we also know that the road runoff is actually toxic to rainbow trout and the Chinook salmon. And there's ongoing study about 6-PPD quinone to these other salmon and trout. And hopefully we will see the result on these organisms pretty soon. And the focus of this seminar, right, is about chrome rubber and potential human exposure, right? Probably we are now thinking something like a tire flip, but the chrome rubber is a very prevalent facility in a lot of communities. So what about the exposure of these to human, right? Like, what are the chemical profiles of chrome rubber? Are they similar with the tires, right? They are made from tires. And also, how toxic are these chemicals to human beings? These are the questions. And our preliminary data can at least answer some of the part of the first question, the chemical side. So in Washington State, we collected chrome rubber samples from 6 artificial turf fields. We did simple solvent extraction, and we used our high resolution mass spectrometry to do suspect and non-target screening to see if the tire chemicals are in there. And here's some preliminary result. What we are sure is we see both 6-PPD and 6-PPD quinone in this chrome rubber samples. We can see this figure, this chromatogram, 6-PPD is there, this very obvious peak. 6-PPD quinone is here. And when we did the quantification with the commercial standard, we found that 6-PPD quinone, the concentration is actually comparable with just like the tire rubber. So it means, the aging did not affect the concentration like a lot. And also we have seen other typical tire chemicals in the chrome rubber. Some of these we have seen in the mortality signature, right? Like diphenylguanidine, like HMMM. And these chemicals are really dominating in the tire rubber, but in the chrome rubber, we see these 2 chemicals, the responses are lower. We haven't accurately quantified them, but we can see from the response, these things might be affected by the aging process from the tire rubber to the chrome. And also we have seen something like SDPA and of course phthalates. These chemicals are known endocrine disruptors, right? But also we have seen various transformation products. Some of these are from 6-PPD, some of these are from diphenylguanidine, because all these chemicals, when they are in the environment, they go through the transformation. And some of the structures are at least concerning, because if you think about what are they, right? Like these aromatic amines, and this is a nitrosyl group. Compounds with similar functional groups are usually of harmful effects. So it's hardly to say that, without any risk assessment to see these things are safe. And this actually leads to the future research need, because a lot of these chemicals we see in tire rubber and chrome rubber are emerging or previously unknown. So it means we don't have analytical standards for any of these, not any of them, some of these, but also we don't have good toxicological data for them. So it means we cannot measure them very accurately, and we don't know how toxic are they. So this is really the issue, right? Without a comprehensive risk assessment, we can now say those things are safe. And I think a whole mixture toxicity on those are very necessary. So this figure below is from a European risk assessment study. Although the conclusion says it's probably not very risky, right, for the players on the artificial field, but there's some kind of interesting implication, right? So we can see, according to this risk quotient, some of the most risky chemicals are 6-PPD, which we just saw, and then BPA. We're familiar with the, it's a plasticizer in the plastics, right? Bottles, things like those. And also aniline stand out as one of the more risky ones, but actually no one deliberately add aniline to the chrome. So why is that, right? It is because aniline is a known transformation product from DPG, right? So DPG itself, the risk is low, but when you have its fragment, something more dangerous come out. So this is really important implication why we need to consider this emerging or transformation products. Okay, so probably some of you know about EPA and NTP report, although they say their results are not sufficient as risk assessment, but there are some really good data on their method as well as the chemistry. So we are using them as good resources for our future research. So hopefully we will collaborate with TURI on some of the prom rubber safety research in the future. And here are my students collecting prom rubber samples from the field. Hopefully we can have some good research on this. And that's all for my presentation. Let me know if you have any questions. Thanks.
Great, thank you so much, Zhenyu. We're going to be moving on to our final speaker, Sarah Evans. While she's playing for slides, feel free to keep putting in those questions. If we don't get to all of your questions today during our Q&A, we'll try and get back to you as we can. And I'll be passing on the questions to our speakers after the webinar. All right, take it away, Sarah.
Okay, great. Thank you so much to Rachel and Lindsey and Zhenyu for those great presentations. And thank you, Hannah, for having me today. So I'm going to use the remaining time to put some of what you just heard from the previous speakers about the composition of artificial turf into the context of children's exposures and health impacts. And so I am with the Institute for Exposomics Research in Environmental Medicine and Public Health at Mount Sinai. And so at Mount Sinai, I work with a team of clinicians and research scientists, and we are really united in a common goal of not only identifying how environment impacts health, but also in educating communities and advocating for safer practices and policies. And so we, perhaps like TURI, also get a number of inquiries from communities about safer play on artificial turf. So I'm going to talk a little bit about how we've supported them with evidence-based information on turf. So a central motivator to the work that we do at Mount Sinai is the fact that chronic diseases are on the rise, and we know that all of them have an environmental component. And importantly, many of these illnesses have origins in childhood and also disproportionately impact low income and communities of color. So by identifying and preventing harmful exposures, we know that we can dramatically improve population health. So briefly, I'm going to touch on why children are most vulnerable to play on turf, some of the chemicals of concern that you heard about and what the health impacts are, as well as the impacts of heat exposures, injuries, and abrasions. And I'm going to end with tips for safer play and safer choices of turf. So we're particularly concerned about turf surfaces and exposures to children. By looking at exposures across the lifespan, from preconception through old age, we know that early fetal development and periods throughout childhood are really most vulnerable to environmental impacts because these are periods when organ systems are rapidly developing. And I always like to emphasize that teenagers and young adults, many of whom are also playing on artificial turf, continue to be equally vulnerable because their reproductive systems and nervous systems continue to develop well into adulthood. And then in addition to their rapidly developing body systems, children are also at risk because of their normal behaviors and physiology. So, children are closer to the ground where chemicals and dust settle. They roll around in the ground, play in the dirt, put their hands in their mouths and on their faces. They also are not as able to regulate their body temperature or hydrate as well as adults. So that puts them at greater risk for heat exposures. And they breathe more rapidly and inhale a greater volume of air compared to adults. So they're more at risk for exposure to pollutants through inhalation. So it's not surprising that studies that do human biomonitoring, so looking at chemicals in human blood and urine, find that many of the over 200 chemicals that are found in the bodies of most Americans are highest in children. Many of these chemicals are also higher in Black and Brown participants in these studies, which are conducted by the CDC. And this is evidence that environmental and structural racism are likely contributors to health inequities. And so, you've heard a little bit from the previous exposures about the vast number of chemicals, many of which we haven't even identified yet, that are present in artificial turf. And one of the major barriers to confirming safety is the fact that typical risk assessments really only look at one chemical at a time. And we're very concerned about chronic, very low dose and cumulative exposures that occur, such as a child might experience through playing on turf with these mixtures of chemicals that they're exposed to. And so we really are trying to get at what's the clinical relevance of these chronic low dose cumulative exposures to hundreds of chemicals that occur throughout the lifespan and, including during very vulnerable times of development. So there are three main routes of exposure that we think about when we think about exposures that occur on turf. These would be inhalation of chemicals and dust particles, dermal contact, so absorption through the skin, but also through open wounds. I'm going to talk a little bit more about that. And ingestion, often accidental of turf infill, but also ingestion that can occur if chemicals rub off onto the hands and skin of players, and then they eat or put their hands on their faces. And so many of the chemicals that Rachel talked about are known carcinogens. They're known to be harmful to the nervous system, particularly during development. Reproductive toxicants like phthalates, which you heard about, are endocrine or hormone disruptors, and also respiratory irritants. So Rachel alluded a little bit to some of the dust that is created through some of the infill types, and that can be inhaled. And I also wanted to point out something that's timely and relevant is that the PFAS chemicals, which you heard discussed because they've been found to be present and to leach off of the grass blades, have been shown to interfere with immune function and actually to blunt response to vaccination. So this is something that I think is really relevant to many of us as we think about the COVID-19 pandemic. And we also know that exposure to many of these chemicals is impacted by things like weather, by the type of play that occurs on the turf, but we don't have good biomonitoring studies. So I mentioned the biomonitoring that the CDC does. We don't have good studies that show whether these chemicals are present in the bodies of children, in particular, directly after they play on turf. So this is a big gap in our understanding of exposures that occur. But we do know that these harmful chemicals are present. And so Zhenyu already referred to the federal turf study that's underway for several years now by US EPA together with the CDC. And they launched the study largely because there were concerns about all of these chemicals that are present in turf. So acknowledging that there are concerns. And one of the major conclusions that they came to after doing a comprehensive literature review as the first phase of this study was that studies to date have limitations and do not comprehensively evaluate concerns about health risks from exposure to tire crumb rubber. So this report is largely based on tire crumb. And so this really highlighted, again, the lack of evidence for safety that we have following play on these surfaces. So we're equally concerned about the effects of exposure to heat on turf. We know that artificial turf surfaces expose children to dangerous heat conditions. They absorb solar radiation and they don't allow for evaporation like natural grass does, which has a cooling effect. And so they've been shown to reach surface temperatures of up to 200 degrees Fahrenheit. This is much higher than the surface temperature found on natural grass under equal ambient air conditions. And much hotter than the air. Increased air temperature has also been measured at head height, which is very concerning. And this is a phenomenon that's been shown not just for crumb rubber, but also for many of the alternative infills that Rachel mentioned. All of these surfaces get much hotter than natural grass because they lack the ability to cool. And unfortunately, irrigation provides limited cooling. So some studies have shown that following irrigation, you may only get 5 minutes of cooling on a hot day before the temperature rebounds. And this is an image from a paper by one of my colleagues at Mount Sinai, Luz Claudio, showing satellite imaging where the darker portions of the image are hotter. And you can see that where an artificial turf field is in New York City was as hot as a black asphalt roof. So this really has the effect of creating a heat island, what we refer to as a heat island in an urban area, which can really diminish any cooling effect that a natural area or a park might have for a community, which is particularly concerning in an urban area like New York City. And oops. So these are some more images showing that not only do we see elevated temperatures on turf fields, we also see greatly elevated temperatures on crumb rubber or artificial playground surfaces. And so these are studies done by another Mount Sinai colleague, Homer Harari. And so he found that on an 80-degree day in New York City, he could measure up close to 102 degrees Fahrenheit on an artificial turf field, and on a playground surface where small children, you can imagine, crawling around, maybe they have bare feet, exposed hands and skin, the surface temperature reached almost 160 degrees Fahrenheit. And I just want to point out that with climate change, we're experiencing hotter days, more heat waves, and so the days where play may be extremely risky are only increasing. And so obviously there are health effects of these really high temperatures. Heat illness is the #1 cause of death and disability in high school athletes. And although many studies have looked at how football players are impacted, other individuals who use these surfaces, like marching bands, who may spend several hours a day throughout the summer on these fields wearing very heavy, often wool uniforms, can become very dehydrated and suffer from heat stroke. And skin burns can be experienced at the temperatures that you just saw on the previous slides. 1st degree and 2nd degree skin burns are a high risk. And so there's also a fair amount of data that supports increased knee injuries on turf because of greater resistance between shoes and turf that can cause rotational injuries and result in ligament tears, as well as increased risk of skin abrasions and resulting infections. And these are the main reasons why the U.S. women's soccer team put up a fight for many years to not be forced to play on artificial turf like their male counterparts were able to play on grass. This is an image from a U.S. professional women's soccer player, Sydney Leroux, saying this is why soccer should be played on grass, and showing how her legs typically looked after play on one of these fields. And you can see that some of the infill is actually adhering to her wounds. And you can imagine that there's a greater risk of chemical exposures through the open skin and the taking home of all of these pellets that are sticking to her. We also have concerns about concussion impacts on turf. And so the hardness of the fields, all turf fields are inherently harder than natural grass. And so they require proper maintenance and monitoring to ensure that they are at an appropriate hardness for play. And many fields are not properly maintained. And so this is a real risk. Temperature can also impact how hard the field is as well. And I should mention also that the U.S. women's soccer team succeeded with a lawsuit in December of 2020, and they are now permitted to play on natural grass. And so we also are concerned about indirect health effects related to the use of turf fields. So turf can impact climate change essentially throughout its lifespan. They're giant plastic and rubber carpets. And so they use a massive amount of petroleum to generate. They create heat islands, as I mentioned. They can contribute to flooding because they don't drain well and water can't be absorbed. It's kind of like a parking lot. And they also emit greenhouse gas throughout their life, and then particularly when they're disposed of and potentially enter a landfill. And of course, there are all a whole host of effects of climate change on human health as well. So we do have thousands of turf fields installed throughout the country. They're very difficult to convert to grass. And so we do get inquiries from communities often asking, not only how can they make a safer choice of a field for their community, but how can we keep our children safe on the existing fields that we have. And so I would say that first and foremost, posting a safety warning, speaking with athletic directors and park departments about educating the community about safer play on these surfaces. So this is a sign, this is an example of a sign in Westport, Connecticut, which is a town that we have worked with before that recently banned the use of chrome rubber on their fields, but they have this signage on a fence at an elementary school telling people how they can stay safe from exposures on the field. It's also really important to educate communities about how to stay safe on hot days. And so programs should be put in place where the surface temperature of the field is monitored and a plan is made for what will happen when temperatures reach a certain level. And avoiding lounging and passive activities and things like picnicking on these surfaces is also a way to avoid exposure. So sometimes we see that these fields are installed in a community where it's their only green space or it's the only play area that they have. And that's really unfortunate because that increases the likelihood that small children are going to use it, that it's going to be used for a lot of community activities. And so, we really recommend that passive activities and things like lounging are not done on these fields. Washing hands before touching your face and eating them, and cleaning cuts, and not taking the turf home with you. So removing and shaking out gear and clothes, and brushing hair and showering immediately are all ways to try to terminate the exposure. And monitoring small children for ingestion. And we do know that indoor fields have much poorer air quality. So inhalational exposures are a big concern indoors. And so proper ventilation is really important if you have those types of surfaces. And then we receive a lot of inquiries about how to choose a safer surface. I think as the data that TURI presented earlier shows, there aren't really any artificial turf surfaces that are free of chemicals of concern. There's some that may be better than others, but really our first recommendation is to consider properly maintained and well-drained grass fields. For playground surfaces, fortunately, there are some great alternatives to using the poured in place or the rubber, and the Consumer Product Safety Commission lists many of these in their playground handbook. Looking out for greenwashing is really important these days. There are a lot of companies that are pushing natural, eco-friendly, organic, purported organic products, but it's important to recognize that those terms are not third-party tested. There's no uniform certification, and there's no definition for those. And looking for transparency. So looking for safety data sheets to tell you exactly what's in the product. I think Zhenyu's analyses really showed us that it's difficult to be entirely certain because there are concerns about byproducts and contaminants that may not have been in the original product, hidden costs like disposal and maintenance fees and maintenance chemicals. I think I saw a question in the Q&A about this. There's sometimes a misconception that artificial turf fields are a better alternative to grass because they reduce the need for pesticides. But if you read the fine print in many of the maintenance manuals, these surfaces are meant to be treated with disinfectants and pesticides as well. So there are chemical applications and exposures that are possible with these. And I think it's important to consider the site. Again, as we saw with the salmon, are these fields being situated near wetlands or groundwater sources, a residential community? Is there any shade? And then I think importantly, is this an environmental justice community and being cited where people already have a disproportionate burden to exposure to pollutants? So I'll just end by highlighting that we've seen the greatest success in changing practices and policies through coordinated efforts between scientists and advocates and community members. And so you can get some more information about a lot of what I talked about at our Partnership for Healthy Playing Surfaces website. This is a collaborative between Mount Sinai as well as TURI and other advocates and community members who have firsthand experience in promoting healthy playing surfaces in their own communities. And you can also visit our Sinai Exposomics website for some more information about turf, as well as other environmental exposures. So we maintain a library of resources for communities and policymakers, as well as for youth on a number of environmental exposures. And you can stay up to date with us by following us on social media. And then lastly, I'll just acknowledge the team that I work with at Mount Sinai and our Pediatric Environmental Health Specialty Unit and New York State Children's Environmental Health Center, as well as our funding from the National Institute of Environmental Health Sciences. Thank you.
Wow, thank you, everyone. Those were really interesting talks. So we have dozens of questions. We're definitely not going to get to all of them, but I will do my best to see what I can do. So I'm going to start out real quick with trying to summarize a few of them and group them into categories. So for Lindsey, probably, there's a few questions about grass and using grass on playing fields in places that say have mud, like the Pacific Northwest, or a lot of rain, or in drought areas, that sort of thing. You know, places that maybe it doesn't snow, and so they're used year round, unlike in the Massachusetts where you don't use them in the winter. And I'm wondering if you could just sort of discuss that, or also different kinds of grass in different places of the country.
Sure. So I'll start by saying that I'm not a grass athletic field expert. There are consultants that specialize in this subject. They're super knowledgeable. We've worked with a lot of them that have helped us put these materials together. So I'll just start there. But I've learned a lot on this journey. And so to that question, I would say there seems to be a solution for all different types of environments. We've worked with several communities that also had mud pits as athletic fields. It just wasn't working for them. They were just not managed properly. And with the right kind of fertilizer, the right kind of seed, they were able to create a really great, resilient play area. And so I know that in those arid areas, it's also really tricky with you know, reducing water loads on these athletic fields. And so I could really answer the same way there. There's lots of techniques and technologies that are available to help really reduce the need for water on those fields. Using the right kind of drought tolerant seed is very helpful as well. So I think overall, what I would suggest is really to reach out to a local consultant that really specializes in our athletic fields made with natural grass. And we know of a few that work in more of the northeastern area, but we're happy to share those contacts if that's helpful.
Yeah, thank you. Also, just to note that all the studies and resources that were mentioned, there's a link on the web page for this call. So those are available. There was a couple questions about disposal and recycling of the turf. And I think, Dr. Massey, you covered that a little bit. I wonder if you could elaborate some.
Well, I guess I can just say that in general, at the end of the useful life of an artificial turf field, that is a challenge to find a way to dispose of it, and there is a lack of readily available recycling opportunities in the U.S. Also, it's a complex material where you've got multiple materials mixed together, so it's not particularly well suited to recycling. There have been a few really good pieces of investigative journalism on this, and we have them linked in the frequently asked questions section of our website, and perhaps we could add them to, I don't know if we could add them to the CHE website, but so the Atlantic has done investigative journalism on the fate of artificial turf fields. There was also there have been some European investigative journalists who have documented stockpiling of very large quantities of artificial turf fields. And as we started the discussion with the talking about waste tires, and something that I could have sort of skipped over in that narrative is that historically there were really serious problems with stockpiles of waste tires and huge tire piles that then presented environmental problems. And would sometimes catch on fire, and then those tire fires were extremely difficult to extinguish. So a lot of this effort to shred tires and turn them into tire crumb has been a response to that difficulty of dealing with that waste product. But then when you get to the end of the useful life of the artificial turf product, you also end up with stockpiles of that used product. So I guess those are just some general comments, and I see that Hannah did say that we can add links to the CHE website, so we can add some of those investigative journalism links.
And maybe we can also include some of the resources for the grass things that you mentioned, Lindsay. If you could send us that, we could put them online because someone also asked about that. All right, what about, can we talk more about the PFAS in turf? I don't know who maybe could talk about that a little bit, but some people are saying that the people they were talking to denied that there was PFAS or that it was safe PFAS, you know.
I can comment on that a little bit, and maybe Jen, you will want to comment on it as well. So yeah, I think there's a lot of confusion in the communication about PFAS, and not just in the artificial turf arena, but for many consumer products, there are claims about products being PFAS free when they're not actually free of PFAS. They're simply free of a very small subset of PFAS for which targeted testing has been done. So anyway, that actually, what were there other questions on the PFAS issue?
Would it run off from the fields and get into an aquifer?
That is a question that I think is being actively investigated. So, you know, well, I think the data need to be collected on that.
All right. A few people have asked about poured in place surfaces on playgrounds, like on running tracks. I don't know if that's at all the same or totally different question.
I can take a quick stab. Sorry, I was coughing. I had to turn off my camera. Yeah, so the poured in place is made from many of the same products that we talked about. Sometimes it's recycled tire, sometimes it may be a virgin rubber. One issue with that is that it also has other components like glues and things that help it stick together. So it's even more of a mixture of chemicals that can off gas, that, as I showed, gets very, very hot. So we have additional concerns about that. Obviously, children are very close to the ground, often eating when they're on those surfaces. So yes, we have similar concerns and also additional concerns about those. Part of the EPA study is to look at playgrounds specifically with the Consumer Product Safety Commission. A lot of those studies, we didn't get into that in too much detail, but their studies have been largely delayed by COVID. They do have plans to do caregiver interviews, to look at child behavior on the playgrounds, to look at child exposures, but much of that has been delayed. So it's taking a long time, but there's a lot that we don't know about those playground surfaces.
And
go ahead.
Lindsay, you go ahead.
Okay, I'll just add a little more there. Rachel and I looked into this topic a few years ago as well. And like Sarah just mentioned, there's a lot of overlap with the materials used in artificial turf infill. And actually artificial turf is used as a playground surfacing sometimes as well. But I just wanted to also refer everyone to a report that we put together that investigates or looks into these materials a little bit more, and the same with artificial turf, our artificial turf resources. And so we looked at pour in place, we looked at the loose crumb rubber surfacing, and also the more mineral and plant-based options as well, and found that engineered wood fibers are actually a safer option. But we can send a link to that report as well.
Okay, Sarah, real quick, your slide that said titled chemicals of concern in turf, is that specifically referring to artificial turf with crumb rubber or artificial turf with any infill?
That list is largely from crumb rubber. I also had, oh, and was the title crumb rubber? It should have been artificial turf, but no. So some of those chemicals like PFAS, for example, are from the grass blades. So yes, many of the same chemicals that have been identified in crumb rubber, recycled tire, artificial turf have also been identified by some of the work that TURI and others have done on other types of infill, but just at different concentrations. But Rachel, I don't know if you want to expand on that.
Yeah, so I guess I would just say, and I saw there was also a question about just which infill would we recommend, which is sort of a a related question, which we have wish that we had a very easy answer to. But yeah, so tire crumb contains large quantities of chemicals of concern, and in some cases high concentrations of those chemicals. And then many of the alternatives have either fewer of those chemicals or lower concentrations, but are not completely free of those chemicals. Maybe I guess I'm just repeating what we said before.
And I'll just add that was by no means a comprehensive list. Those were some of the big ones, but there are hundreds of chemicals.
And I guess maybe just something to say further is that a lot of this decision making is on a continuum, and so certainly if a community is already committed to having artificial turf and doesn't have a way to avoid that, it certainly would still make sense to find a way to avoid tire crumb by working to choose something safer and doing as much research as you can on that alternative material.
We haven't even gotten to the salmon questions. It's already 2:15 later. So we do have a long list of questions, and Dr. Tian did answer a lot of them in writing. And Hannah, are we going to be able to?
I think we can go on. We can go on for another 5 minutes and maybe get to.
Okay. I'm just wondering, someone asked, are we going to be able to get? Can people see the questions and answers? Like, can we post those after on the website?
Yeah, I can post those on the web page that we have the webinar on, and so people can see the questions and the responses. That'd be great.
Right, because some of the questions people have typed answers to, and sorry, it's hard for me to go through all 60 of these and get it quick. Anyway, so Dr. Tian, some of the interesting questions, I can't find them now, but someone asked 15 years ago, it seems like the coho salmon started dying off. Was there a change back then, or was there something that happened? And in the future, are they working to get rid of this stuff in the tires?
Cool. So I think, yeah, this is definitely interesting questions. One of the reasons that people began to notice this is there are this like restoration kind of effort, right? So previously it's like, creeks in the city are generally like, not there. And like in the recent like 20 or 15 years, people are, the city of Seattle and other municipalities, they are trying to get salmon back, and there's citizen scientists and the volunteer always looking around the creek to see the situation. And this is the time people became more aware of this. But if this phenomenon is happening like, much earlier than that, people just don't know, right? And if similar things are happening to even smaller fish or like, juvenile salmon, people just don't see them because they are too small. So I guess it's like, do you see them or not, right? And what's the second question?
If the industry is working to get this chemical out of the tires.
Sure, I think we've been contacted by the association as well as some industries. Seems like they are working on making safer alternatives, but we still don't know what these greener alternatives will be. So we will see when things are coming out.
And then I want to address the question that says can you share the presentations and the recordings and yes, all this is public, all this, stuff you can share it in whatever newsletters you have. Totally fine. Oh boy. Sorry.
We have quite a few questions, and we really appreciate all.
Yeah, is there any questions that you guys saw? How about that? That you want to answer verbally? That you saw on the list of 75 or 90 questions?
I will just jump in and say that people can contact us at Mount Sinai. You can go to the information that I shared or links, which will be on the webinar page, I think, and you can reach out to us with any additional questions about turf and health or for community support.
I guess I had one final question about just policy implications and where this is moving in terms of instead of having communities individually come to you. Have you seen any best practices in terms of policies in any region of this country or moves towards that to better protect populations?
There have been some community bans on certain types of products, on chrome rubber. Some states, Connecticut, for use on playgrounds. So yeah, there's been some, I guess, incremental progress. I wouldn't say there's been a lot of progress, but there are, particularly at the municipal level, towns and cities that are at least stopping using recycled tire chrome.
And in the European Union, there are newly adopted regulations related to the level of PAHs that are allowable in artificial turf infill. So that could be a useful policy model. There's also, I think there have been some efforts to think about creating an extended producer responsibility model for artificial turf, as there have been for other categories of products. So that could be also an interesting policy avenue to pursue.
Then a little more locally in Massachusetts, there's special regulations around Zone 1 wellhead protection areas, and there's only certain types of construction that can happen in those areas. And we worked with a community that learned as they were putting plans together for an artificial turf field that it wasn't allowed in that zone. And then I'm just thinking about another community that in Massachusetts that now has regulations on surface temperatures of playing areas, of playing fields. So that really, it's more directed towards artificial turf fields because those get much hotter than grass fields.
And can I ask one more question? Someone said there haven't been any good epidemiological studies. No one has looked at, kids playing on the turf fields. Nothing.
In a nutshell, yes. I will say that at Mount Sinai, we have tried to get funding to do that. It's tricky. It's a messy study to do, but it's a necessary study. So, a lot of the things that we're concerned about have long latencies to develop, like cancers. So you have to, often the best way to do that is to enroll participants early and track how they play, and then look to see, maybe decades to see what diseases they go on to develop. Washington State did look to see whether they could identify a cancer cluster in soccer players who played on turf in Washington State, and you can find some of the results for that. They concluded that it did not qualify as a cancer cluster. There were some limitations to what they did there, and they're pretty open about the limitations. And they concluded essentially they concluded that you cannot conclude safety, acknowledging that these chemicals are present in the turf. Their study did not conclude that playing on turf does not increase risk of cancer. It just concluded that what they looked at did not qualify as a cancer cluster, which is something very specific. So that's the only study that I know of that has attempted to look at whether playing on turf is linked to cancer in humans.
I'll just add a little bit to that. So what the Washington Department of Health did is that they took a list of young people who had played sports and had cancer, and that list was created by Amy Griffin, an elite women's soccer coach. So it was a community-generated list. They didn't do any active identification of cases, and then they did a kind of back of the envelope calculation to estimate the total number of cancers that could have occurred in the state in a wide range of ages over a lengthy period of years. So they basically compared a community-generated list with a kind of hypothetical, very large number of potential cancers. And so they did state clearly that their study was not designed to determine whether there was increased risk of cancer, as Sarah said. There has been one other study that was designed as an ecological study, and if we had more time, we could comment on that, but it also really wasn't designed in a way that could have picked up any increased cancer risk if it was present. And I think, it's important to bear in mind that we don't need epidemiological evidence in order to make decisions about reducing children and young people's exposures to toxic chemicals. We have plenty of information about the presence of these toxic chemicals and about safer alternatives. At the same time, I do think we owe it to the communities that have had these exposures and would like to have more information about the health outcomes. We do owe it to them to do an epidemiological study at some point, but that's not necessary in order to take common sense steps to adopt safer alternatives.
Yeah, and now I also, there's a few more questions about about other infills and potential problems with them. Like someone mentioned PFAS and the wood chips, and someone mentioned sand, flame retardants, antimicrobials, fungicides. Someone also mentioned I can't even remember. Mold on organic. And if you have to treat to prevent mold, if anyone could talk about this.
I think we probably can't get into all the details, although we can refer people to our publications where we've gone into quite a lot of detail and trying to examine these materials. On the questions about presence of PFAS or presence of flame retardants, I think those are questions that are important to pose to vendors, and it's important to get lab testing data before purchasing a product. On antimicrobials, there are some infill products that actually have an antimicrobial built in, and so that is information that's readily available from the vendors. And the question there is what might the environmental impacts be of that use. Questions about fungi are also very good questions, and we have a little bit of information on what we were able to glean about. Sometimes there could be issues with cork dust, for example, but I'd have to just say it's something that you really have to look into for every material, and you have to request information from the vendors and look at any independently available lab testing.
All right. Thank you, guys. I think we are good now. I'm sorry we didn't get to everything, but really there's like over 100 questions. So we will try to do what we can as far as posting those online, and the recording will be online. I'll send it over to Hannah now. She can summarize all that.
Yeah, and I just want to thank you. I think the amount of questions we got is an indication that this is a really important topic that we need to know more about, and would be happy for anything you want to share with our audience. We'll follow up with that. All right, well, thank you so much. We're approaching the end of today's webinar. A video recording will be available on Che's website soon, and tomorrow you'll receive an email containing the link to this video. If you are new to Che and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate these Che partnership webinars bringing you the latest environmental health research for free, we encourage you to support Che's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers, Rachel, Lindsey, Zhenyu, and Sarah for taking time to present today, and you, Sarah Howard, for your excellent moderation, handling all those questions. Thank you so much for joining us. We're wishing all much health and wellness. We'll be in touch. Have a great day.